Hey everyone, and welcome back to the channel. Today, we're diving into a topic that touches millions of lives globally, yet often flies under the radar: chronic kidney disease, or CKD. It sounds complex, right? But understanding it is absolutely crucial for our health. So, grab a comfy seat because we're going to break down everything you need to know about CKD in a way that's easy to understand and empowering. First things first, what exactly are our kidneys and why are they so important? Think of your kidneys as your body's amazing filtration system. These two bean-shaped organs, nestled just below your ribcage, work tirelessly 24/7. Their main job is to filter about 120 to 150 quarts of blood every single day, removing waste products, excess water, and toxins, which are then excreted as urine. But they do so much more. They help control blood pressure, produce red blood cells, and keep your bones healthy by activating vitamin D. Pretty incredible, right? Now, chronic kidney disease happens when your kidneys are damaged and can't filter blood as well as they should. This damage often happens slowly, over many years, which is why CKD is often called a silent killer. Many people don't even realize they have it until it's quite advanced. This slow progression means waste products can build up in your body, leading to serious health issues. We're talking about a condition that affects over 1 in 7 adults in the US alone. That's a staggering 37 million people. And unfortunately, a lot of them don't know it. So, what causes CKD? The two biggest culprits are high blood pressure and diabetes. If you have either of these conditions, especially if they're not well managed, you're at a much higher risk. High blood pressure can narrow and damage the tiny blood vessels in your kidneys, reducing their ability to filter blood. Similarly, high blood sugar from diabetes can damage these delicate filters over time. Other causes include autoimmune diseases like lupus, genetic conditions like polycystic kidney disease, certain infections, long-term use of some medications, and even kidney stones or enlarged prostate that block urine flow. Understanding these risk factors is the first step in prevention. One of the most challenging things about CKD is that in its early stages, there are often no symptoms. You could feel perfectly fine while your kidneys are slowly losing their function. As the disease progresses, however, symptoms can start to appear. These might include feeling more tired than usual, swelling in your ankles and feet, muscle cramps, needing to urinate more often, especially at night, dry and itchy skin, poor appetite, nausea, and trouble concentrating. Because these symptoms can be vague and attributed to other things, it's easy to overlook them. This is why regular checkups are so important, especially if you have risk factors. How is CKD diagnosed? It's surprisingly simple. A blood test called a GFR, or glomerular filtration rate, measures how well your kidneys are filtering. A urine test can also check for protein in your urine, which is an early sign of kidney damage. If your doctor suspects CKD, they might also recommend an ultrasound to check the size and structure of your kidneys. These tests are quick, non-invasive, and can provide vital information about your kidney health. Don't wait for symptoms to appear. Talk to your doctor about getting screened if you have risk factors. Once diagnosed, CKD is typically divided into 5 stages based on your GIT. Stage 1 is very mild damage, while Stage 5 is kidney failure, also known as end-stage renal disease or ESRD, where your kidneys have largely stopped working. The goal of treatment is to slow down the progression of the disease and manage any complications. So, what does managing CKD involve? It's a multifaceted approach, often starting with lifestyle changes. Eating a kidney-friendly diet is key. This usually means reducing sodium, potassium, and phosphorus intake, and sometimes protein. A registered dietitian specializing in kidney health can be an incredible resource here. Regular physical activity, maintaining a healthy weight, and quitting smoking are also vital. For those with high blood pressure or diabetes, strict management of these conditions is paramount. This might involve medications to control blood pressure or blood sugar levels. Your doctor might also prescribe medications to help protect your kidneys, manage cholesterol, or treat anemia. The good news is that with early diagnosis and proactive management, many people can live full and active lives while managing CKD. However, if CKD progresses to stage 5, kidney failure treatment options become more intensive. The 2 main treatments for ESRD are dialysis and kidney transplant. Dialysis is a medical procedure that takes over the job of your kidneys, filtering waste and excess fluid from your blood. There are 2 main types. Hemodialysis, usually done at a clinic several times a week, and peritoneal dialysis, which can often be done at home. A kidney transplant involves surgically placing a healthy kidney from a deceased or living donor into your body. This can be a life-changing option, offering greater freedom and improved quality of life compared to long-term dialysis. It's a complex process, but for many, it provides the best outcome. Living with CKD can certainly present challenges, both physical and emotional. It's important to remember that you're not alone. Building a strong support system, including family, friends, and healthcare professionals, can make a huge difference. Joining support groups, either online or in person, can provide a sense of community and shared understanding. Open communication with your medical team about any concerns or symptoms is crucial. They are your partners in managing this condition. So, what can we all do to protect our kidneys and prevent CKD? It boils down to a few key things. First, manage your blood pressure. Get it checked regularly, and if it's high, work with your doctor to control it through lifestyle and medication. Second, control your blood sugar. If you have diabetes, diligent management is essential for kidney health. Third, make healthy lifestyle choices. Eat a balanced diet, limit processed foods, exercise regularly, maintain a healthy weight, and don't smoke. Fourth, be mindful of over-the-counter pain medications like NSAIDs. Regular high-dose use can damage kidneys over time, so always use them as directed. And finally, get regular checkups with your doctor. If you have any risk factors for CKD, ask about kidney screening tests. Early detection really is the best defense. Taking care of our kidneys is an investment in our overall health and well-being. They're incredible organs, and by understanding CKD and taking proactive steps, we can help keep them functioning at their best for years to come. Remember, knowledge is power, and knowing your risk factors and symptoms can lead to early diagnosis and better outcomes. Thank you so much for watching today. I hope this deep dive into chronic kidney disease has been informative and empowering. If you found this video helpful, please give it a thumbs up. Share it with someone who might benefit, and don't forget to subscribe to the channel for more health insights and tips. Your support helps us create more content like this. Stay healthy, and I'll see you in the next video.